Shortcuts, the #1 pre-reg online training platform with over 85% student pass rate, 100% money back guarantee on some of our products. Study from the comfort of your home. Outstanding customer service. 30 plus B&F, MEP and calculation videos. 100 plus up-to-date GPhC style questions. Welcome to Pre-Reg Shortcuts, the #1 pre-reg online training platform with over 85% student pass rate, 100% money back guarantee on some of our products. Study from the comfort of your home. Outstanding customer service. 30 plus B&F, MEP and calculation videos. 100 plus up-to-date GPhC style questions. Welcome to Pre-Reg Shortcuts, the #1 pre-reg online training platform with over 85% student pass rate, 100% money back guarantee on some of our products. Study from the comfort of your home. Outstanding customer service. 30 plus B&F, MEP and calculation videos. 100 plus up-to-date GPhC style questions.
Hello everybody. Hello, if you can see me, please put yes. If you can hear me, let me just make sure everything is working fantastic. So if you can see me right now, if you can hear me, please just type in yes. Just put a yes down. Let me just make sure I can see everyone. So we've got about 73 people on now. We've got our group on YouTube. So if you're on YouTube, just type in. If you're on YouTube, just type in 1, and Facebook, just type in yes. So I'm just trying to bring up some of your chats on my screen. Let's get some comments there. Yeah, so Nu, I'm there. I just want to give a shout out to all of you. Nu, can you guys just tell me, if you just write down where you're dialing from? So if you're from Manchester, from London, just type down, because I just want to give you a shout. So I've got Audrey Chachu. How are you, Audrey? Got Sharina on there. Liana, Quenda. Gosh, we've got about 100 people on. We've got Darius. If you just type in where you're dialing from tonight. We've got Aliyah Muhammad. How are you, Aliyah? News from Cardiff. Hello, New from Cardiff. Wow, Shahira from London. How are you, Shahira? I've got Emma from Manchester. Thomas from Blackpool. Aisha from Birmingham. Wow. From all over. Christopher Croydon. Fantastic. How are you, Christopher? Sanya's from Wycombe. We've got Kechi from Bradford. Amenzi from Cheltenham. How are you, Amenzi? We've got JF from Zimbabwe. Wow, we've got someone from Zimbabwe. That's amazing. Ife from London. How are you, Ife? Brilliant. Quenda's from Maidstone. Audrey's from Good. Right. So thank you very much, guys, for logging on. I'm just trying to make sure we're connected, trying to put your comments up. So today is going to be a very special day, because we're going to start our series, our revision sessions today. And as I explained to you guys, we're going to go through the entire BNF. So we're going to start with chapter 1 today. We're going to go through a few things. So some of you have seen the advert that I put out there. We're going to take our time. We're going to go through each part of the BNF. We're going to go through some summaries, and I'm going to show you the plan that we're going to have today. So I'm just Lola from Liverpool. Oh, Liverpool, mate. I love Liverpool. Scouser. How are you, Lola? Amens, Mohammed Salah. How are you, Mohammed Salah? Pablo, thank you for logging on. So let me show you guys. Let me just share my screen so that I can show you what we're going to do today. So today will be really good. I've got some good stuff for all of you. Very, very good learning today. Mohammed Salah is from East London. Fantastic. So let me share my screen. If at any point, guys, if there's no connection, if you guys cannot hear me, if my voice disappears or my screen goes off, please just let me know in the comments so that I can reconnect. So if you guys are ready for a great evening tonight of learning, of fun, of interaction, just type, give me a love heart. Give me a love heart. If you're ready for a good evening tonight, just give me a love heart. Just give me a love heart. Those of you on YouTube, just give me a 1. So thank you. Before we start, so those of you that make sure that we're going to be doing this every week. So could you guys, those of you on Facebook, you need to like the page so that you could get notified when we're on. We've got about 121 people on now, which is quite cool. And then on Facebook, if you could just tap that notification so that you subscribe, and then whenever we come on, you get that notification. We've got about 121 people on here right now. Could you guys do me a very quick favor, because there are many of us. if you can just share the bottom of your screen, if you just type share, if you just share this with your friends or on your wall, anyone that will benefit, because we've got very, very good information for you today. It's going to be very interactive. I don't want any pre-reg student to miss out. So if you've got any friends or anyone, just share this. I'll really appreciate from the bottom of my heart if you can just share this on your wall or with your friends and invite anyone to watch the session. So let me just share my screen. I'll show you guys what we're going to cover today. Normally when my screen comes up, I cannot see your comments. I'm going to see if I could get that on another computer. So I won't be ignoring anyone. If you've written something, I can't hear you. So let me, oh, by the way, before we start, let me just give you guys the rules for today. We're going to go through a lecture. We're going to go through the GI system, a couple of topics with mainly we're going to look at things like IBS, IBD. We're going to look at constipation. But at the same time, at the end, we're going to do some exam-style questions. So I've got about 7 exam-style, up-to-date exam-style questions for you to practice. But the main thing I'm going to ask you guys is we're going to do them under exam conditions. So when it comes to the questions, you have 1 minute to answer the question. If you can, please just avoid putting your answer. I'm going to time you. I've got a little timer here. So I'm going to time you for the 1 minute so you start practicing the way you do that in the exam. And then don't put any answers down. Once the 1 minute is up, I'm going to ask you to put your answers down, and then we're going to go through them. Is that cool? If you think that sounds good, give me a 2, give me a 2. If you're ready for this, give me a 2, give me a 2, give me a 2, give me a 2, give me a 2. Brilliant, brilliant. Let me get my slides on for you. So screen share. All right, so these are my slides. I'll make that bigger. I cannot see your comments now once I make this big. However, I'm just going to turn on my other computer so I can at least see your comments when they come through. So this will, just if you don't know me, I just logged in today. I was not here last week. Last week, we spoke about mind maps, so just an introduction. But now we're going to just focus on the BNF. My name is Marvin Munzu. I'm a pharmacy manager. I'm a superintendent pharmacist, BBC featured media pharmacist. I'm the author of the book Success Secrets for Students. I'm a personal trainer, Jake Mann's media expert. I'm an international speaker, the co-founder of Pre-Reg Shortcuts. So most of you are here because you know about Pre-Reg Shortcuts, which I founded with my colleague Umar Majid. I also received an award as Community Pharmacy Manager of the Year. I was nominated by the CND as one of the top most influential pharmacists. I'm also UK natural bodybuilding champion. So obviously those of you who know about me, that's a bit about myself. But as I always say, this evening is all about you. It's not about me, it's about you. So here's what we've got to cover today. So in terms of the agenda, we're going to look into celiac disease. So if you guys have your BNF, oh, where's my BNF? Let me see if I can find it. So if you have your BNF, what I've done is I want to go to the BNF in detail because that's what we do. We give, remember last week we spoke about quality notes, gives you quality results. So if you go into your BNF from chapter 1, and if you look in there, you have like on the appendix, the way it's structured for you, that's sort of the plan I'm going to follow. So if you go to page 37, those of you that have got your BNF, under contents, you've got chronic bowel disorders. And so today we're going to do the first part, which is under chronic bowel disorders. We're going to look at 1.1 to 1.5. So we're going to cover celiac disease, diverticular disease and diverticulitis, inflammatory bowel disease, irritable bowel syndrome, short bowel syndrome. We're going to do that today. We're also going to do constipation. And then at the end, we're going to have some exam style questions. We're going to have 7 exam style questions. You're going to do them under time conditions, under 1 minute. Then I'm going to ask you for your answer. We're going to give you the answer and then feedback on what the right answer is. So brilliant. So that's the plan for today. So I'm going to need you guys to interact with me because I always do interactive sessions. I want you to have fun in this process. It's not a boring university lecture. It is an interactive learning sort of summary capture lecture for your exam. So that's the first question I want to ask you guys. I'll just need you to type your comments. What is celiac disease? What do you think it is? Just type it down. Let me see if I can bring a few comments up. So what is celiac disease? Just log into another computer so that I can see some of your comments. Yes, so if you just, there's a little delay there, but just type in what you think celiac disease is, please. Okay, let's see. All right, so I'm just looking at some of the comments I have on here. I might not see your comments, but I've got from Trisha Patel, I've got gluten intolerance. Anyone have any? Remember, I spoke about keywords last time. Any other definitions? I said this might be a little delay. So I've got autoimmune response against gluten by Sanam. Fantastic. So the main thing you need to know about celiac disease or CD, it is an autoimmune response. It's normally triggered by gluten. And you normally have common symptoms when it comes to celiac disease. For your exam, you need to know what the definition is. You need to know what the trigger is, which is normally gluten. And then you need to know about the signs and symptoms and also the risk factors when it comes to celiac disease. So it's an autoimmune condition that's triggered by gluten. It's inflammations in your small intestines. And also, a very important part for you to remember about celiac disease is malabsorption of nutrients. So most people that have got celiac disease do not absorb key nutrients very well. And so that causes a deficiency. And I've got Noor written on there. Yes, I was going to ask that next question. What do you guys think? What are the things you need to avoid, right? Or the gluten, what are the products? When we talk about celiac disease, what do they need to avoid? What are the main things that we're looking at that have got high gluten in them? Amy, how are you, Amy? Amy's put increased risk of osteoporosis. Yes, right. So we've got a number of people that are on our course that did the course. We've done 2 courses already, about 100 students in each course. Is anyone here from the course? If you're from the course, just give me a 1 and just write down how you found the course, okay? Just write down how you found the course. If you did in October or if you did in January, just type down how you found the course. So I've got wheat. Yeah, so we're looking at wheat, we're looking at rye, we're looking at barley, okay? Barley, wheat, and rye. So what generally happens in the exam, you do not get as many questions on chapter 1, right? But you will potentially get some, okay? You don't get as many compared to chapter 2, when we get chapter 2. But however, we're going to focus on some of the key parts of this chapter where you potentially get questions from. That's what we're going to do towards the end, okay? Or at the end. So let's look at the symptoms. What are the symptoms of celiac disease? What are the symptoms of celiac disease? So Sanam says the course was really insightful. Thank you, Sanam. Amy says amazing, fantastic. Really happy to be here tonight with all of you. I really appreciate all of you logging on, taking your time after work to be here. Yes, so symptoms of celiac disease, what we got? Let me check out your comments again. So I've got bloating. That's from Trisha. Do you guys want me to give you a good code? I always give on the course, and most of the people in the course can testify. I always give good acronyms that can help you to remember stuff. So Sanam has put something down. Sanya has put down one of the acronyms that we use in the course. Those of you that need to know, the acronym is ABCD. Best way to remember the symptoms of celiac disease is ABCD. So A is for abdominal pain, B is for bloating, C is for constipation, and D is for diarrhea. Okay, ABCD, symptoms of celiac disease, just in case it comes up in your exam. So there you go. Those are the main symptoms you need to learn. You need to know them. A very important one of the complications from nutrient malabsorption. What are the key nutrients that you guys think? When we talk about celiac disease, which nutrients are we talking about? So you need to know this as well. If it comes up in a question in a different form, they could ask you that patients that normally have gluten intolerance or patients that have got celiac disease, what condition are they at risk of getting? And you need to know that from the deficiency of certain nutrients. So what do you guys think? What nutrients are we looking at? So Rara says, I had 2 mocks and I passed both of them just from listening to the webinars. Oh, fantastic. Great. Thank you for that feedback, Rara. Yes, so I said the webinars we've done, the course is very interactive and many students pass. We have over 85% pass rate. Very proud of all the students. And we give 100%. So anyone that's on the course can testify that when we do the webinars, we give every single thing we have to make you succeed. So I've got calcium from Amy. I've got Kwenda says vitamin D. Sanya says calcium and vitamin D. Helen Ahmed says osteoporosis. How are you, Helen? Helen says osteoporosis, calcium, and vitamin D. Great. And Sanam says vitamin D, C, folic acid, B12. Great. So the main ones are your calcium and your vitamin D. However, latest guidelines have also mentioned the importance of folic acid as well. So you're looking at folic acid, B12, vitamin D, and calcium. The main thing is if someone doesn't absorb these nutrients effectively, then they have a risk of getting bone disease and also osteoporosis. So you need to make that connection between the risk of osteoporosis and CD, celiac disease. Is this all clear? If this is all clear, please type in 1. Type in 1. If this is all clear, you think, wow, that's fine, Marvin, that's clear. Good stuff. So next question for you is, you need to know how celiac disease is managed in terms of the treatment. So how do you guys think this is managed? How do you manage celiac disease? What's the most effective treatment for celiac disease? Pavani says 1. If you just log it in now, if you just like to just write down where you're dialing from, what town, what country. We've got someone today all the way from Zimbabwe. We've got people from London, from Birmingham, from Manchester, from Liverpool. Brilliant. So I've got a lot of ones going on. Okay. So in terms of the management, the most effective way to manage celiac disease is what Sanam has written, is a strict gluten diet restriction. So the quickest way is to avoid what's causing it. So avoid gluten, because that's what's causing. That's the most effective way. And then in terms of medications, what else can you give? What other medications are used in celiac disease? Yeah, so Quenda says diet, stay away from gluten rich products. That's correct, Quenda. Miriam Langer says avoid gluten. Fantastic. So gluten-free diet, avoid gluten. In terms, you need some supplementations. As we've mentioned, that most people that have got celiac disease have a high risk of malabsorption of key nutrients. So calcium, vitamin D, folic acid, as well as vitamin B12. But these are like the main ones for you to at least know. So if it comes up in an exam, you'll know exactly which ones to put down, okay? And then you also have prednisolone as well. But the number 1 is gluten-free diet. So what 2 conditions patients with celiac disease are at risk of? So what do you guys think? We've mentioned one of the risks already. So patients that have celiac disease, what are the 2 main conditions that they have a risk of getting? Again, there is a delay. There is a delay, obviously, in the answers. As you can see, I'm looking over to another screen. I'm not ignoring anyone. It's simply because I cannot see your comments when I've got my slides on. So I need to look at the other monitor to see what your comments are. So prednisolone for initial management from Ayub, that's correct. Vitamin supplements for Amy, correct. Osteoporosis for Miriam, so that's one of them. So osteoporosis, and then the second one we've mentioned, malabsorption of key nutrients, okay? Osteoporosis, because you're not getting enough calcium, you're not getting enough vitamin D, so you have a high risk of getting osteoporosis and then malabsorption of key nutrients. So another important thing for you guys to know is the difference between diverticulitis and diverticular disease. So I know everyone on the course should know this now, but everyone on the course, there's a few things I've added on here that we don't have on the course. It might be 1 or 2 things I've added on this slide, but everyone on the course is entitled to this because those are part of the course. We'll get all of this videos, the slides. We have the group as well. We have the Telegram group. So if you're just dialing in now, you're just joining us, if you just want to say your name and where you're dialing from. So I'm asked, the question now is, what is the difference between diverticulitis and diverticular disease? If you don't know what it is, please put 0, because I just want to know the level that everyone is at. So if you don't know what the difference is, just type 0. Those of you on YouTube, put 0, right? Facebook, 0. And if you know what it is, just put what the difference is. And we're going to sort that. So I've got Sanam that says, from the course as well, Sanam, diverticular disease is sac-like appearance with intermittent pain but no inflammation, while diverticulitis is inflammation and is marked with pain. Miriam says 0, thanks. So that's correct. So the best way for you guys to know, the quite 2 words that are used sort of interchangeably, but they are completely different in the sense that if you look, I put that in red, itis should be a clue to tell you inflammation. When you see itis, you think inflammation, don't you? Itis, you think about inflammation, you think about infection. So the main difference is when you look at diverticulitis and diverticular disease, you're looking at abdominal pain. The other things like bloating, but the main thing is abdominal pain. But the difference between diverticulitis is with this pain also comes an infection and inflammation. All right, so someone that's got diverticulitis, the pain of abdominal pain is more serious. They also have symptoms such as fever because of the infection. They also have inflammation. While someone that only has diverticular disease would probably just experience more of just abdominal pain. Does that make sense? If that makes sense, just type 1. If you didn't know that, you know that now, just type 2. Brilliant. So main difference is inflammation and infection with itis compared to diverticular disease. So what are the symptoms? For example, you need to know what are the symptoms of diverticular disease and diverticulitis. So I've already mentioned some of them. Can you guys just type in what you think the symptoms are? So this sessions will normally last an hour. Based on how we go, it might be slightly longer, the questions, but we're always aiming for to do everything within an hour. So 8:30 to 9:30. So yeah, I'm getting number ones there. That's very good. So the main symptoms are abdominal pain, which is normally the left side. You get constipation or diarrhea, or sometimes you get both, constipation and diarrhea, a bit like what you have sometimes with IBS as well. You get mucus, blood in stool, and fever. A good tip I want to give you guys is that for most bowel conditions, you will have abdominal pain, and then you will also have blood in stool or mucus sometimes. So abdominal pain is a common sort of side effect or symptom that you will normally get with your bowel sort of disorders. So Quenda says fever, pain in the abdomen, diarrhea, correct. Quenda's got nausea as well. You could potentially get nausea, malaise, fever with diverticulitis, good stuff. So another important thing is for you guys to know definitions. So you need to know all your definitions. You need to know the definition of diverticular disease, definition of diverticulitis, definition of IBS, definition of IBD. You need to know the difference in symptoms. You need to know how they present themselves. So let's look at IBD. What is IBD? When we talk about IBD, what are we looking at? Inflammatory bowel disease. How would you guys define IBD? So I'm just going to look at your comments here. Again, it's a delay. And I think those of you on YouTube might even get a longer delay. So I'll give you the answers and then I'll see your answers because of the delay. So normally with IBD, we're looking at two key things. We're looking at Crohn's disease and ulcerative colitis. All right, you need to know the difference between both of them, and you need to know the medications that are used to treat them. So Sanam says it is an umbrella term that covers chronic inflammation disease, Crohn's disease, and ulcerative colitis. Fantastic. So that is exactly what it is, all right? Crohn's disease and ulcerative colitis. Brilliant, your answers are coming in now. Emmanuel shared the stream. Thank you, Emanuela. Emanuela just shared the stream. Thank you so much, I appreciate it. Guys, if you could share the stream, that's all I ask for. We're doing all these free sessions. I'll give you all my time. I'm going to spend time to make sure all of you guys pass and you do well on your exam. But all I ask for from the bottom of my heart is please just share this. If you could just share this, then that's all I ask for in the sessions. So thank you very much, Emanuela, for doing that. Really appreciate it. Okay, so ulcerative colitis and Crohn's disease. So what is the difference between both now? What is the difference between ulcerative colitis and Crohn's? Anyone know what the difference is? And I'm just giving you very quick, easy differences. Okay, not detailed, but just quick things. Remember that we have a course, and on the course we have detailed notes of everything. Okay, so lovely people on there like Amy, like Sanem, they've all been on the course. So on the course, you get more detailed notes, but these sessions are not detailed notes. This is just revision, just to recap. But if you wanted like the detailed notes of every single chapter, then you just have to go on our website and you could get on the course and get an automated version of the course. So yes, so the main difference is really where they act, okay, where you have the symptoms. So with colitis is the colon. Okay, so guess what they think about is COL, colitis, colon. Why for Crohn's, that's normally GI tract. Okay, so ulcerative colitis, COL, colon, Crohn's, GI tract. All right, so Gasho says mainly Crohn's mainly affects GI, correct? While ulcerative colitis is mainly your colon. So if you did not know that, you know that now. I think, wow, that's good. I know that now. Please give me a 2. Give me a 2, type 2, type 2, type 2, so that I know that you're learning something new. So very important is for us to know that what the symptoms of IBD are, and that could come up in your exam. Okay. So what do you guys think are the symptoms? If you could just type down what some of the symptoms are for inflammatory bowel disease. Helen says 2. Thank you very much. So thank you guys. If you're learning anything new today, just give it a thumbs up. Let me just know. If you're learning anything new today, go, okay, I'm learning this. This is cool. This is good. I want more of this. Marvin, I want to do more of this. Then just give me a like. Just type like. If you're on YouTube, just type 2. Just type 2 community. But if you're on Facebook, just give a like. If wow, I want you to do more of this, and then I'll do more of it. So the symptoms of IBD, I've got Sanam says abdo pain, diarrhea, constipation. You can tell Sanam's in the course or was in the course, part of the group. We also have a Telegram group as well. So most of the students are part of the Telegram group as well, where we get together, we share information, we support each other. It's fantastic. So I'm getting a lot of likes coming up there. So that's brilliant. These are the symptoms for you. Okay, these are your symptoms: abdominal pain, anemia, mouth ulcers, rectal bleeding, diarrhea, fever, weight loss, anal fissures. So these are the main ones. Why have I put these ones in red? Because it's sort of the most common ones that stand out. Okay. I've got constipation, diarrhea for Miriam. Gosha says liver inflammation, skin rash. Yes, you could with this as well. Brilliant. So I said these are the main symptoms, but not exhaustive. But these are the main ones for you to at least know for your exam. All right. So let's look at the medications. You need to also know the medications that are used in IBD. All right, let's look at the medications. So what medications are used in IBD? As I said, when I was doing my pre-reg, I used to get confused between IBS. I used to get confused with IBD. Good news for you is I've got a mind map for you at the end of this as well. I've got a brilliant mind map. It's going to be small from this slide, looking at it from this, but then I'll obviously, those in the group, I'm going to send you guys the full picture of the mind map, because that's what I use, mind maps for revision. So I'll send that out to you guys, but you guys will see an illustration here at the end. Okay, so diarrhea, pain, abdominal pain. So what are medications used in IBD? I can't see the comments now because there's a delay, but I'll give you guys the answers. So aminosalicylates, very important, such as mesalazine. Drugs affecting your immune response, e.g. methotrexate. Cytokine modulators, adalimumab and all the mumabs, antidiarrheal drugs such as loperamide, corticosteroids, laxatives. So yes, so your answers are coming up now. It's quite a shame because there's a delay with the comments coming. So I'll ask a question, I need to wait a bit long before I see them. Then I can see all your answers. Very good. So Gasho has got aminosalicylates, very good, and it's got examples of them. Let me see what else we've got. Got quite a few. Let me just scroll that. So I've got aminosalicylates. Sanam's got aminosalicylates, steroids, and infliximab. Good stuff. Amy's got prednisolone, initial not maintenance, aminosalicylates or cytokine modulators. All correct. All correct. Bertha Williams. Bertha Williams. Good to see you, Bertha. It's got steroids. If you're joining us right now, just type in where you're dialing in from so that I could give you a shout out. Miriam says MXT, which is methotrexate. Brilliant. So right, so these are your medications that you use. So you need to know your medications. Again, as I said, this is we're just giving you a quick summary. That's what you guys need now. But if you wanted the details, then you have to get that from the notes. Our notes are more detailed than this. So what are some of the symptoms of IBS? What are symptoms of IBS? So thanks very much, guys. I can see a couple of you shared this. Thank you so much. So that's really what I asked for. I really appreciate you guys sharing this. Thank you so much. Thank you so much. So I've got what are some of the symptoms of IBS then? Inflammatory bowel syndrome. IBS. Oh, so Bertha is from Sunderland. How are you, Bertha? I was in Sunderland about 2 years ago. I went to the university to give a talk to the pharmacy students, because I travel a bit to the universities to do like motivational talks. I wonder if you were part of that group then, but that was about 2 years ago. But yeah, it was lovely, very beautiful uni, very beautiful uni. I think they've done a lot of renovations in the uni as well. It's all green, it's really nice. Sirin Tan says abdominal pain, diarrhea, constipation. That's good, Sirin. I think that's where some of the symptoms of IBS. So diarrhea and constipation are the main ones we think about alternating, don't we? So Sade Valentine says constipation. Good. Miriam says gas, abdo pain, constipation, diarrhea, depression. Yeah. Good. Bertha says good thanks. Good, Bertha. Aoife says bloating. Fantastic. So common symptoms again: abdo pain, diarrhea, constipation, urgency, bloating, mucus passage, and incomplete evacuation. Right. So these are your main symptoms for IBS. As you can see, there's always they're quite similar with other bowel conditions. That's why you need to know the difference, because don't confuse IBD with IBS, diverticular disease with diverticulitis. So that if it comes up in the exam, you'll be able to smash this. Okay, so let's look at the medications that are used now in IBS. So what sort of medications are used in IBS, guys? So if someone comes to pharmacy and they've got IBS, what medication would you sell to them, or what would you recommend? Ayub Saima, diarrhea, constipation, bloating. How are you, Ayub? So I'm just waiting for your answers. I have to move on because the answers are taking time to come up, and I'm aware of time as well for you. So mebeverine has come up there. Okay, so mebeverine by Ife. Sanam says laxatives, anti-diarrhea, good stuff. Maybe I'm mebeverine. So I'm getting loads of mebeverines, right? The antispasmodics, fantastic. Mebeverine, yeah. So a lot of that, your buscopan and things. So you have lifestyle. I've got SSRIs from Amy TCAs. That's correct. You can. They're unlicensed. Right, antidepressants, SSRIs, and TCAs are unlicensed, but yes, you can use them. Obviously, you wouldn't sell that over the counter, but the last resort, yes, you can use a TCA and an SSRI. So lifestyle antispasmodics, laxatives, except lactulose. So you need to know that lactulose causes bloating. That's very important, even for your exam, but we'll come into that later on. But before we come into that, what sort of laxative is lactulose? What group? If someone could just type in, because you need to know this, but we'll come to that later on. What group does lactulose fall under? So just type in the answer. That will probably come later, but I'm going to see that I'll know what you guys are answering. So what group does lactulose, what type of laxative is lactulose? You have linaglutide, anti-motivated drugs, TCAs, and SSRIs, as Amy mentioned. Osmotic, fantastic. Yes, so osmotic. If you didn't know it was osmotic, just put a 0. If you didn't know it was an osmotic laxative, put a 0, because then I'm going to show you a good way and good acronyms that can help you to know all the groups and also know the laxatives that fall under each group. So what medications cause constipation? What medication? I didn't put a slide on here for this one, but what medications for your exam, you need to know what medications cause constipation. So if you guys can just type in, there's quite a lot of medications, but it's worth just knowing which medications generally cause constipation. You just type in the different ones that you know. As I said, there's just so many. So I didn't want to put on an exhaustive list of drugs that cause constipation. There's quite a few, but we could name some of the main ones that we see regularly in the pharmacy or we dispense. So opioids was the first one I had in my mind. So the first that comes to mind is opioids, right? I see many people are typing in opioids because that's the first thing that comes to mind when you think about constipation. Iron as well. Iron can cause both constipation and diarrhea. Iron can cause both. But yes, great. Okay, so sorry, I went to the next slide. So this is very important for your exam. Red flags. You need to know what your red flag symptoms are, especially with constipation. In fact, with all sort of bowel conditions, you need to know your red flags. You need to know all your red flags. They do come up in the exam and also very important in practice. So can you guys answer this question? What do you guys think are the red flags with constipation? What are your red flags? Those that will alert you, those that will make you take it serious or take a different course of action. What are we looking at? What are your red flags? So I've got blood from serum, blood. Yes, I'm guessing that's like blood in the stool. Yes, Helen says the same thing, blood in the stool, correct. Any other symptoms that are red flag symptoms? Gosha Kanabi says new onset patient and over 50, fantastic. So these are areas where you can get questions in the exam, okay? I'm going to show the main areas. So on this chapter, you don't get as many questions, but you do get questions. The area where you might get questions from is when it comes to constipation and laxatives. And so I've done a separate, at the end, I'm going to show you, I've done a separate summary just on constipation for you. But constipation, you really need to know a lot about constipation because that's where they could get questions from if they're asking questions in this chapter. So medicine induced is greater than 3 weeks, blood in stool, fantastic, Amy, very good. So these are your red flags, and I've put that in red for you. By the way, can you guys see the slides clearly? Just give me 1 if you think, well, Marvin, this is fine, this is clear, because what I try to do is make it bold and less things on there. I try to use black and white as well, so that at least it shows more, because we're looking at small screens that way. Some of you might be on your mobile phone, but if you guys can see this clearly and think, right, I can see the slides clearly, there's no issues, just type 1, please, for me. Just type 1. Those of you on YouTube, just put 1 as well, so that I know that the slides are fine, okay? For me, they look all right, but I need to know how you're seeing from your end. So I've put that in red because it's just a good trigger for your mind. Colors, to know that red flags are in red, 50 plus years, anemia, abdominal pain, weight loss, blood in stool. So these are red signs for constipation. Any patient that has this, then you need to probably refer them. So what are the different types of laxatives? Exam question. So this is very important for your exam. These are the areas where you could get questions on this in the exam. All right. So laxatives. What are the different types of laxatives, guys? What are the different types? So we have 4 main groups. What are they? What are the 4 main groups of laxatives? So if you know the groups, type them down. If you don't know, please put a 0 so that I make sure that you know, and I'll give you a good code as well, a good acronym that's going to help you to remember all the 4 groups of laxatives. So I'm just going to wait because I'm waiting for your comments to come up. Okay. Right. Okay. So that was a bit of delay, but it's all on there. So let me see what you guys have written down. I've got bulk forming from Bertha. Good. All your answers are coming down now. I've got Ayub says osmotic bulk stimulant softener. Good stuff. Osmotic stimulant softener. Great. So I'm getting a lot of answers that the 4 main groups. The 4 groups anyway. It might be another group, I don't know, but I always know about the 4 main ones. So if there's a 5th one, please forgive me for that. But Amy, lovely Amy on the course, has written down the acronym, which is BOSS. Okay, the acronym is BOSS, BOSS, and B is for bulk, O is for osmotic, S is for stimulant, and the other S is for softeners. Okay, if you didn't know that and you know that now and think, wow, this is BOSS, just type 2, okay, and give it a nice like. Just if you're on Facebook, give it a nice like. If you're on YouTube, just put a nice 2. If you're like, wow, this is BOSS, I didn't know about this BOSS acronym and I know now. Just type, in fact, just type in BOSS. If you didn't know and you know now, just type BOSS. So those are your main classes. Okay, the main classes of laxatives. Okay, so bulk. So you need to know the bulk. You need to know examples. So brand Ispagola Hos, Steculia, Meta, Cellulose. You need to know examples of osmotics. So macrogos. I've tried to help you with certain things. So if you look at macrogos, for example, Laxido is LA, lactulose, os, osmotic, lactulose, os, osmotic. So we use a lot of BOSS and we use a lot of os. Okay, I'm going to show you guys how to use BOSS and how to use os to smash this chapter. So LA, they form the same group and they're both oses, okay, osmotic. Then you got stimulants such as your senna, your bisacodyl, you got softeners like liquid paraffin, like arachis oil and things like that. But and then you have the other ones that you use as a last resort. These are like your linaglutide and prucalopride. These are very strong medications and normally used last resort for constipation. So if this is BOSS, this is cool. You're ready to go on. Very good, very nice from Sam. Quenda's too good. BOSS from Quenda, fantastic. So so please learn the different groups and also learn the examples. Okay, so and then another thing you need to know is you need to know how each class works for exam. You need to know how each class works. So do you guys know the mechanism of actions of each of them? Do you know like how bulk laxatives work and how osmotics work, how stimulants work, how softeners work? So you need to know that. You need to know mechanism of actions. Very simple, just 1 or 2 lines, but you just need to know them just in case it comes up in exam. I'm going to have a question here as well for you just to show you how it could come up in your exam. So how does it work? These are the mechanism of action. So all your bulk ones, as the word says bulk, what they do is they increase the mass of the stool, okay? So they increase that fecal mass so that it could help with peristalsis, so that it could go through your gut properly or through the bladder. So it makes it a bit thicker, makes your stool a bit thicker, a bit bigger, then it could flow through the wave-like motion through your GI, not your GI tract, through the colon, and it could go out. Okay, so the onset, you need to know about your onset as well. The onset is up to 72 hours. So patients that are on bulk, they may not get an immediate effect. So the bowels may not open immediately. It may take up to 72 hours. They're also known for causing what we call intestinal obstruction. So the advice is if anyone is going to take a bulk laxative, they need to take it with plenty of water. Okay, and should not take it just before going to bed. You shouldn't take it just before going to bed because they could swell up in your stomach, okay? Things that they can do is they can exacerbate flatulence, they can exacerbate bloating, and they can also exacerbate cramping. So at the end, we're going to go through questions to show you how you can apply all of this knowledge, okay? Osmotic, just like the word osmosis, a stronger solution pours the weaker one. So it's literally an increase in water in the large bowel, okay? So these ones just pull water into your large bowel so that can soften things up, that can help you to eject the fecal mass. Example of osmotics, you need to know, as we mentioned, things like lactulose, macrogals, and lactulose could be used to treat hepatic encephalopathy. You've got stimulants. These increase intestinal motility, so they just help with the contractions in your intestine. And that's why they cause abdominal cramps. That's why things like Senna, although they act fast within 8 hours, they should open your bowels. But the downside is they can also cause a lot of abdo pain or abdominal cramps. Then you have what you call codantrama, and it's an example of stimulants, but these are normally used in terminal ill patients, okay, because they're quite cytotoxic as well. Then you have your softeners, and all they do is just reduce surface tension, increase penetration of fluid into fecal mass. So just soften, like the word says, softener, just soften that fecal mass so it gets soft and then you could get out of your system. So that you just know your 4 different ways, and that's what we mean. We'll talk about knowing the different mechanisms of action, how they act, important for your exam, okay? Part of your GPhC framework, you need to know this, and your pre-reg manual. You need to know the different things when it comes to how this works. So this is a good code I've got for you. Another part that you need to know, so you know about the different classes, number 1. You know about the examples of each class. You need to know about the mechanism of actions, which we've covered. Then the next thing is you need to know the order, which ones are used. And this is where you will get the exam questions. You need to know in terms of recommendations, which ones are used for which conditions. So though we talk about constipation, you could have, you have a different order for constipation in children. It's going to be different with constipation from opioids. It's going to be different for constipation, for chronic constipation. You have to use a different medication. It's also going to be different, say, if you had fecal impaction. So different things there you need to know when to use. But guess what, guys? I've got something good for you, because I'm going to give you another easy way, a good formula that's going to help you to remember what's what. All right. So next slide now is to show you. Do you guys know? Okay, so we've got short. I'll just give you this. So you got what we call short duration constipation. If this comes up in the exam, we use BOS. What BOS means is your bulk first, then your osmotic, then your stimulant. Okay. The S's here are for stimulants and not for softeners. Forget about softeners. But this is a good code for you. So short duration constipation, you use BOS. Pregnancy, you use BOS. And chronic constipation, you use BOS. The first 3 use BOS. So my acronym is SPC is BOS. Okay? SPC is BOS. So think short duration constipation came up in the exam. You know, it has to be B first, then O. So it has to be a bulk laxative first. Then if that's not working, osmotic laxative. If that's not working, a stimulant. The same with pregnancy. They give you a question in the exam, and it was a lady that was pregnant, she was constipation, and they're asking what to recommend. Pregnancy is BOS, so it has to be bulk, osmotic, or stimulant. So SPCs, the first 3, SPC is BOS. By the way, I've got a very good summary. Do you guys struggle with SPCs? Just put a 1 if you like to have something on SPCs. So I've got very good slides, things I've put together for SPCs that I can do for you. But SPC is BOS, and then the second part is you got your opioid-induced constipation. So the last 3 you use OS. First 3 use BOS. If this is cool, you think, wow, that's good, give it a like, give it a thumbs up, put great, right? Type great. But so the first 3 is BOS, and the bottom 3, OS. Comes up in the exam, BOS top 3, bottom 3, OS. So OS simply means the first one you give is an osmotic laxative, and the second will be a stimulant laxative. So if it's an opioid-induced constipation, then it's OS. So you have to give it osmotic, then stimulant. If it's a fecal impaction, it's OS. If it's children, OS. So what I've done is for this one, the code that I use is called focus, right? And this focus, the reason why I have CH is so that you don't get confused between the top one, the C in the top one, which is CH as well, because it's chronic, isn't it? So I might put something else, but it's just so that you don't confuse the CH at the top with the CH at the bottom. But the bottom one, OS, is children, okay? So that CH is for children, not for chronic, okay? SPC is BOS, and then focus. If you think this is very good, please just type good. Fantastic. So, guys, you'll be pleased to know, that's it. What time is it now? So we've got, wow, 9:15. So we spent about 45 minutes already. How many of you felt that this has gone really quick? Like 45 minutes. This is exactly how the webinars are. So people like Amy and all of you on the course on here can testify. Sanam, we do 2-hour webinars, like intense webinars, like twice a week. And the time goes so fast in those webinars. So that's it. What we're going to do now is with everything that you do, you need to be able to apply the knowledge. And the thing is, just reading the BNF and your notes is not enough. You need to be able to apply that in terms of answering questions. So the last part we're going to do now is we're going to do some past questions that I've set. I actually put these questions myself. They're quite good. They're like up-to-date GPhC style questions. So we're going to go through this, and then we'll see your answers. Okay, are you guys ready for the questions? Just type yes. If you're ready for the questions, just type yes. So I'm going to ask you guys for one thing, please. Please, just one thing I'm going to ask you is the rules of the questions, because we're going to be doing this every week and it's going to be the same pattern. So what we've done today, that's the same thing we're going to do next week and going forward. Okay, yes, it's so quick. Quenda says, yeah, it is so quick. So what we're going to do now is we're going to go through past questions, but please, what I want you guys to do is spend 1 minute on each question, because that's literally what's recommended from the GPhC. Okay, when you're doing your paper 2 of the exam. All right, you spend like a minute on a question. And so what I want you guys to do is to get into the habit and practice. Some will be shorter, some might need a minute. But all I ask for you, out of respect for everyone on here, is don't put your answer down. Okay, don't put any answer. Once you've seen the question, you can write it down, but don't type in the comments, because I don't want to distract anybody else. Just keep your answer. And then when I ask you after the 1 minute, I'm going to stop the time. I'm going to tell you start, and I'm going to tell you stop. And then when I tell you stop and I ask you for your answer, then you guys can just put your answers in the comment, and then we can go to the answer. Is that cool, guys? Is that cool? If that's cool, give it a thumbs up. Just type yes, that's cool. All right. If that's cool, we're all good with the rules, then we're going to go into the questions and we'll do this together. So let me see where my timer is. I've used this before. Does this even work? Okay, it does. All right, great. Right. So you guys ready for? I'm getting a few yeses. So you guys are ready for exam start questions. So let's practice. Let's practice now, guys. The first one, question number 1. I'm going to give you 1 minute, and then we're going to stop. Then I'm going to give you guys the answer. All right, let's go. And your time starts now. Okay, stop. All right, let's stop. I've got Emmy that says they cannot see. Could you guys, as I said, because of what we're using the platform, unfortunately, the questions might be smaller because I'm trying to give you really the exam style questions. So did you guys, were you able to read the question? Type yes if you could. I've just got one person that says I cannot see. If you guys could still see the questions, although it might be smaller in size of the screen, as long as you can see, could you guys see, just type a yes if you could see the question and you could read it clearly, it was fine, just type yes. Okay. So we've done the first question, so I'll just read that out for you. So 45-year-old man suffers from constipation. He had a hip surgery 3 years ago. He also suffers from acid reflux, but otherwise is fine. So I'm getting loads of yeses, which is good. He's taking the following medication: quetiapine 25 milligrams once daily, omeprazole 20 milligrams once daily, codeine phosphate 60 milligrams, 1 tablet 4 times a day. He has no known allergy. So the question is, what is the list? Very important that when you're reading these questions, now we're going to go to exam style questions. So this is an example of the sort of question exam that you're going to get where you need to be very careful when you read little words that the GPhC is going to ask you. So what is the least suitable drug treatment for his constipation? So we're looking for the least suitable drug treatment. So for that one, what is your answer, guys? So there's quite a few things in this question that you need to be very wary of. And that comes, and this is how the GP asks questions. So it won't be as direct. Sometimes you need to connect a few things and have some knowledge, previous knowledge. So I've got metacellulose. Okay, so just type in type in the number D, right? Yes, I've got D. I've got E from Samsam. I've got D from Helen, D from Miriam, Rovimbo D, Amy D, Sirin D, Pavani D. I'm getting loads of these, although I had one E. Okay, so I'm getting loads of these. Anyone got anything? Teresa says D, Bertha says this. Anyone got anything different from D? Any other from D? Just type that in. Okay, so there is a thought process when it comes to these questions. So I'm going to show you guys the answer. So the answer is D. It is D. So well done. Bravo. Thumbs up if you got that right. Type a thumbs up if you got that right. Well done. So your answer is D, and using the formula OS, this is an OS question, okay? Because it's asking you, the answer is going to be OS because we're asking for the least suitable, all right? We're asking for least suitable. The patient is taking codeine, so we're looking at what? We're looking at opioid-induced constipation, aren't we? Okay, so they're taking codeine, and they're taking the maximum dose, really, and so they're going to experience some constipation. So we're looking for the least suitable. So the formula for this, for the constipation, is OS, isn't it? The answer is OS. So if you look at all the other laxatives that we have, all of them are osmotic or stimulant laxatives. There's only one laxative that is not osmotic or stimulant. It is your metacellulose, which is a bulk laxative. So the answer is B. So these are the sort of questions you get. That's the way you need to think. That's why we went through the notes first, and then now you need to apply the knowledge. So well done, those of you that got it D. And then if you did not get it, that's fine. Just learn from it, and by the end of this, you'll be fine as well. So great stuff. And thanks for writing down the answers earlier. We're going through question number 2. So there's question number 2. Timer starts now. Oh. Okay, stop. Right, so our 65-year-old woman started taking Simvastatin 20 milligrams once a day for 1 month ago. She's also been taking quinine 200 milligrams once a day for night cramps for the past 3 years. She feels very lethargic lately. When collecting her repeat medication, she complains of a new onset of constipation. She wonders if her new tablet is to blame for her constipation. So what is the most appropriate advice to give her? Which one do you guys go for? Give me your answers. So again, very important things in that question that you need to know of, and that we've covered some of them. But what do you guys think would be the most appropriate advice for this patient? So Nana says D. Okay, I've got Helen says D. Gwenda says D. Miriam says D. Mark says D. Bertha. So I'm getting loads of D's. I'm getting loads of D's there. Okay. Has anyone got anything different from D? I think I altered these questions a little bit. This looks like a different slide for me, but that's fine. That's fine. I think I altered something on here. Let's see. So the answer indeed is D, right? The answer is D because this patient, Simvastatin, she's obviously suffering lethargic, which could be anemia, all right, which is a red flag. This question requires you to know your red flags. Also requires you to know some of the side effects, have knowledge of side effects. But the main test is to know your red flags. So that's how we could come up in an exam. So Simvastatin doesn't cause constipation, neither does quinine. Both do cause anemia, so the patient might feel a bit lethargic. which is, again, you're looking at red flags. This patient is sort of lethargic. We looked at the age. We said anyone that's 50 plus, that's a red flag. The patient is 65 years old. We spoke about any new onset of constipation. So not just constipation, it has to be a new onset for someone that's over 50. And this patient has a new onset. So well done, all of you guys. Give yourself thumbs up. If you got that correct, give yourself a thumbs up. It means that you're applying the knowledge, you're listening to what we're going through, which is fantastic. Great stuff. So we're going to go to the next question. You guys ready for the next question? So I said we got 7 questions. So the next one, so might go slightly above time. Sorry about that, but let's get these questions out of the way. So that's the next question. Well, that's the answer. A red flag D is the correct answer. And I've highlighted the main things for you to know. So are you guys ready for the next question? So we're going to finish this session very soon. Once we finish the questions, that's it, okay? So next one, trying to reset this stuff. Jeez, how do you reset this thing? I got this from my little girls. They're like, oh yeah, daddy, I've got a good stopwatch for you. So I'm like, really? Yeah, use this. And never listen to kids. All right, you guys ready for the next one? Okay, next question, let's go. There we go. You've got literally 1 minute starting now. Okay, stop. So what's your answer to this one? This one should be a lot easier. What's your answer? You guys put an answer. Yes, I know, because I changed the slides a little bit. I did something different, but it looks like that did save on here. But what's the answer to this one? D. Right, that's why I tried to change, because I knew that when I did it first, loads of D's. I'm thinking, gosh, I got all these D's. But yes, the answer is D as well. It's Movicol Pediatric. Again, it's a test to know about children. What you give them with children, you're still looking at your OS. Great. Are you guys using OS and BOS? If you're using OS and BOS, just type BOS. If you're using that to answer these questions, if you're applying that knowledge, just type BOS in there, because I really want to see. That's very important. That's why I'm giving you the stuff, so you could use it. Okay, so the answer is indeed D. Great stuff. Again, the thumbs up coming up as well. Great. So question number 4. You guys ready for question number 4? Let's go. So there you go. I won't really time this anymore because this is messing up. So I'm just gonna mentally count in my mind. All right. If you guys are enjoying this session so far, give me some feedback. If it's good, just type good. All right. If you're enjoying this and think, wow, this is good, I like it, we want more of this, just type good. Okay, so let's go into question 4. All right, question 4. There you go. Okay, stop. Okay, stop. Great, guys. Really appreciate. Like, no one's putting the answers down early, which is very good. So it's 9:30. Do you guys want me to stop or do you want me to continue the final 3 questions? I'm going to go what you want. So it's exactly 9:30. We said 8:30, 9:30. Do you guys want me to stop? If you want me to stop, put stop. If you want me to continue, type continue. And I'll go through the final 3 questions. What do you guys want? You want me to stop or do you want me to continue? Okay, so what's your answer for this one? What answer do you guys have? That's an interesting one. So I've got Suade says A, Babani says A, Miriam says D, Gosha says D, Nana says D, Ruvimbo, how are you? Ruvimbo says continue, Miriam says continue. Okay, so we'll continue. Ahmed says A, D, so I'm getting A's and I'm getting D's. Interesting. Gosha says continue, please. Sanya says continue, please. All right, we will continue. Beta says continue, please. All right, we've got enough people to continue. All right, so Sam D and Helen A. This is very interesting. This question was set to trap you. This question was set so that you get to a point where you have to decide between A and D. So which is the right one? Is it A or is it D? If you don't know what the answer is, put a 0. Mark Aziz says A. How are you, Mark Aziz? So Mark is on the course as well. Great. So what do you guys think? Right, so I've got that question. Is it D or is it A? So I'm getting loads of A's and I'm getting D's. So in order to know that, you need to read the question, right? So a 45-year-old lady is 32 weeks pregnant. 32 weeks pregnant. So you need to know about constipation pregnancy. Is it us or bus for pregnancy? First question, is it bus or is it us? So let's type down what it is. Is it bus or us for pregnancy? So 45-year-old lady is 32 weeks pregnant and is suffering from constipation. Since pregnant, she suffers from nausea and abdominal cramps. She doesn't have any medical condition and also has no known allergies. It is bus, correct. So what is the most appropriate laxative for this lady? So most of you have put A or D, which is fantastic. It means that you've literally, you know it's us, but you've gone for the O and you've literally put the S away, right? You said S, that's it. We've gone for O, we've gone for the osmotic, so we're going to go for lactulose. Is that right? Okay, so you're correct, but in this case, and that's because I did not tell you this intentionally at the start of this, because in the notes you will have this, okay? But I did not put this. So the answer, the correct answer is D, right? Gwenda says D, boss. Yes. The correct answer is D, boss. So the answer is D, brand supplements. Okay, it's D, it's not A. In this sense, yes, A will be, but we're looking for the most appropriate laxative. In fact, to be honest with you, I think I changed that question slightly because I didn't want to put laxative there, because brand supplements, laxatives, we can consider them as laxatives, but not really. But the answer, I want you guys to know that when it comes to pregnant women, obviously it's lifestyle and high fiber brand supplements. And if that doesn't work, then you start giving them the laxatives. So if you go into your BNF on page 55, the correct answer is D, because the first line after diet and lifestyle is brand supplements, okay, high fiber, fiber supplements. And if that doesn't work or that's not as effective, then you start with the boss. Okay, then you start with the boss. So I didn't mention that at the beginning intentionally, but that's it. Yes, Amy says brand supplement isn't the laxative done. That's why I said perhaps that part, if I had to change that question again, perhaps I would take out laxative. I thought I did last time, because yes, when you see laxative, you might think, okay, might only ask about A, B, C, and E, but I just wanted to know which of these options of all of them will be the most appropriate one. In this case, generally, the most appropriate, if you looked at this and someone asked you that question, I could have changed that with lifestyle advice, okay? If I put lifestyle advice there as well, perhaps, sorry guys, I've got laxative there, might have thrown, because perhaps if I didn't put laxative, or I just put the most appropriate option, then perhaps most of you would have, that put A would have gone for D, because I said laxative, like I need to get laxative. In that case, I'll say you're right as well, yes? But so if I will change that question and I'll just put what is the most appropriate option for this lady. So just a general advice, it's normally lifestyle and diet first for any pregnant lady. And if that doesn't work, it's brand supplements or high fiber. And then you start giving them medication, laxatives, okay? So good stuff, all of you, good stuff. So page 54, you can see that in your BNF. So this is going to be 3 minutes. So I definitely have to time this one. So 3 minutes starting now for 3 questions, 1 minute each. Okay. All right. So stop. So let's see. My screen is going a bit funny, but yes. Can you guys still see me and can you hear me? Because the screen is just disappeared all of a sudden. If you guys can still see me and you can see hear me, just type 1, please, or just put yes. Just type yes. Just want to make sure you can still hear me and you can still see my screen because it's gone a bit blank. Okay, so just type in yes. Let me just make sure. Okay, so I'm not really getting. I don't know. It looks like it's gone blank for some reason. Okay. Okay, I'm just gonna, I don't know if you guys can still see me, but okay. Let me just finish this because I cannot get anything going on my screen for some strange reason. And I can't see any of your comments, but let me just stop sharing and check on the other system. See if this is working. Let me see if this is working. All right, can you guys still see me? Gosh, we've got 193 people on here. Wow. Thanks, guys, for sharing. Can you guys still see me? Because my other screen just went off. If you can still see me and hear me, because I'm getting yeses, give me a yes, please. Then I'm going to go back to share the screen that was shown. Just type a yes. Let me just make sure you can still see me. I'll wait for your yes, then I will go on. Because I'm not really sure why it stopped. You guys, yes, we can see you. Thank you, Cindy. Thank you. It's a lot nicer looking at this screen, to be honest. All right, great. So I'm going to go back to my slide, and then we're just going to go through the answers, okay? I cannot see your comments on the other one, so I won't be able to see your comments because the other one's froze. But yes, so let's go back and let's go. Okay, let me just ask you guys, what's the answer? What's the answer for the first one? Just type your answer for the first question. What's the answer for the first one? Okay, I'm just gonna go in now. Let me just go into the screen share. Hey, that's correct. That's correct. Okay, let me go into it. Okay, that's coming up now. Brilliant. So if I share that screen again and go back to my slide. Yeah, so that's the oh. That's why I see what happened. I knew I had a different slide. I had a different slide to this one. Okay, that's fine. I'm gonna go through the answers with you. So for this one, yeah, the answer is A. So used for the treatment of hepatic encephalopathy, we did mention that, and it's A, it's lactulose, correct? And then what about B? It's licensed for IBS, for the treatment of IBS and moderate to severe constipation. Which one do you guys think it is? So this actually different, yeah, I had a different slide because the different slide had all the answers on there. I knew that was a bit different. I made some changes, but that's fine. This was a lot, so I'll give you guys the answer. So lactulose A is the first one. The second one, licensed for the treatment of moderate to severe IBS associated constipation. That one is H. Okay, linaglutide, it's H. For that one, that's in the BNF again. I think it's page 53. But I'll pull that out for you. As I say, it's on another slide. I don't want to go into that now. I don't want to cut it off. But yeah, so I had another slide which had the answer on there. So the second one is H. It's definitely H. It's linaglutide, and that's in the BNF. But I think it's page 53. And then what is 7? What do you guys have for 7 for the last one? A child who is 5 years old suffering from fecal impaction, whose parents want a laxative to clear the fecal mass and maintain soft, formed stools. Which one do you guys have for that one? Again, that's in the BNF as well. See if I could get the page number in here. I've got G, and the answer to that, the answer to number 7 is G. Okay, it's Macogol 3350. Let me see if I can get the page for that. Yes, so the page for is page 53. Correct. Wow, that's good memory. So on page 53, you have linaglutide, you have the answer to 6. It's linaglutide, and that's on page 63. And then you have you also have on this page, you also have the answer for 7, which is your macrogol. Your macrogol, that's where you give your kids 3350. So that's it, guys. Really, that's it for today. 7 questions all answered, right? So if that's all good, give me a thumbs up. Give me a thumbs up. So finally, just to show you guys, I told you I've got a mind map for everything I do. So this is, you can't see this because this will be a lot smaller than probably you can see right now. But that's the mind map I've done for the bowel, that whole part of the BNF. So IBD, diverticulitis, diverticular disease, celiac, IBS. So this will be sent out. I'll put this on the page as well, on the Facebook page. If you want to access it, those on the Telegram group, I'll send this to you as well, and those on the email list. All right, so that's very important. The next one, so Emma says it does not say pediatric, though, doesn't it matter? It doesn't say pediatric. Which one are you talking about? You talk about a child who is 5 years old. It says from 1 year old. That's fine. Oh, I get what you mean. All right. Okay, macrogol pediatric. I see what you mean, Emmy. All right. Okay, I see. Okay, it doesn't say pediatric. Yes, we can take that. It's macrogol, yes, but I see what I mean. I should put pediatric on there. Okay, yes. If we say that way, yes. Pediatric, we should have pediatric to make it clearer, like we did previously. But yes, it's macrogol pediatric. I'll put that. All right. Okay. So although in the BNF, I said the BNF just says macrogol 3350. Okay, for fecal impactions, I need to double check. In the BNF, it says from 1 year, it's macrogol 3350. I need to also check whether BNF has to have pediatric in there or whether macrogol will be fine for 5 years old, but that's to be checked. Okay, so this is your mind map. And then the second thing I told you guys about laxatives. So I put everything together, laxatives, as you guys can see with the BOSS formula, everything together on there, like a very good way to remember stuff, colorful, nice for you, using mind maps as well, as I spoke about last time. So all of this will be sent to you, those on the group, our Telegram group. You all get this, no problem. I'm going to also post this on our page. So finally, for next week, so we've been asking what we're going to do next week. So I'm going to make sure at the end of each lecture, I'm going to tell you what we're going to cover next week. So every Wednesday, 8:30, 9:30, come on here, and this is what we're going to cover, right? So next week, we're going to look at dyspepsia, gastric and duodenal ulcers, GORD, okay, gastroesophageal reflux disease. We're going to look at Helicobacter pylori and obesity. All right, those of you on YouTube, if you click the notification bell on the YouTube channel now, make sure you subscribe so you get notified when we're on as well. Share this, like the video if you thought this was great, good learning for you. And those of you on Facebook, make sure you like the Facebook page so you'll be notified whenever we come live. But it's going to be every Wednesday from 8:30 to 9:30. Okay, thank all of you for sharing this today. Thank you so much. Wishing you all the best. Enjoy yourselves. Work hard, play hard, study hard. We've got 184 people on here. Thank you so much for making a pleasant evening. Take care, guys, and all the best. And I'll see you all next week, same time, same place. Bye.